there seemed to be like this special exception around gender stuff and eating disorders, where if a patient has gender dysphoria and an eating disorder, what we were told and what I was seeing patients were expecting was that um, you should understand that the eating disorder is a manifestation of the gender dysphoria, because this person isn't comfortable with, let's say it's a female person, right? She's not comfortable having feminine curves. And so she's restricting to try to avoid looking female. And so, what this tells us is not that we need to work on body image or eating healthily or letting go of obsessive compulsive thought patterns that are associated with both the eating disorder and the body dysmorphia and the gender dysphoria, but actually we need to prioritize treating the gender dysphoria. We need to get this kid on puberty blockers and cross-sex hormones and get them the gender affirming care they need, because that's what's driving the eating disorder. It's the discomfort with being female. We need to help this kid escape the pressure of the puberty that their body's trying to go through. And so is almost kind of this like, well, let's not treat the eating disorder. Let's enable the eating disorder. Let's enable the restriction, because it's unfair for this female to have to put on weight and develop curves if she's really a male deep down. I mean, it sounds crazy the way I'm saying it, but I really feel like that was sort of the logic that I was exposed to. And I want to know if you were seeing the same thing in medical school.
Absolutely. And, I think one of the unintended consequences, or maybe the reasons behind that is, um, I, I think that there is a tendency to look at gender differently, um, and really, for lack of a better term, place it in this like binary box of, gender means, are you more feminine or more masculine? And the consequence of that is that if people, I mean, God forbid, if a kid or an adolescent or adult is a bit non-conforming and they are a woman, but they're less feminine, or they're a man, but they're less masculine, that's immediately labeled as gender non-conforming, or gender dysphoria, as opposed to they are an XX or XY, a man or woman, and they're just different than what society has labeled as the expectation to be. And that's fine and wonderful and incredible that we have that kind of uniqueness in the world. But um, it is the fact that I have found that it is because they have that gender has that definition. Literally, the way that my medical school defines gender is a social construct used to delineate characteristics which a society or culture designates as feminine or masculine. In other words,
The
if
circular
a woman,
definition.
yeah, if a woman is more, so if a woman prefers to wear pants and play with trucks and those things that society deems as more masculine, that isn't just that that's what they like and that's who they are. It's that there's something wrong with that their outsides don't match their insides, which again is pretty much as sexist, I think, as it gets. That if you prefer blue and trucks over pink and dolls, and that doesn't align with your sex, then that is gender dysmorphia. I think that has a lot to do with it, in that we're not just teaching people to be that we're not just teaching people that it's okay that they're a little bit different, just as you would with someone who is horrified that they're not a size zero. That it's okay, and we can be who we are, and hang out with people who love us for who we are, and how we interact with others in the world, and that's okay, and we don't have to change that. So I definitely think that that's a part of it.
So far in medical school, has the topic of detransition come up at all?
Not once, literally not once. I mean, I didn't even learn about detransition until I started looking more into this on the outside. But yeah, which is really concerning because I mean, I have, so far I've talked a lot about um, I've talked a lot about the academia side of things, but a big portion of medical school is interacting with patients, and I mean, I have seen some horrific um, complications of gender affirming care, and I've literally cared for um, people that are near death, septic, from these surgeries. And I mean, one person in particular who really stands out in my mind. Um, I mean, they they said that they were in septic shock and dying, but in working to get a history and kind of figure out what's going on, which what ultimately was going on was that their they were a male to female transition. Their vaginoplasty, the canal that was created, a fistula formed between their bladder and that vaginal canal, and there was abscesses in there. But they said that they haven't been able to even touch down there, not one finger, for months because of the horrific pain. And I mean, the swelling and infection was it was just awful. And so after stabilizing that patient, um, there was no discussion of like what was the appropriateness of that surgery, or is this a common complication of gender affirming care? Like literally nothing. It was just, oh, this is something that can happen, and move along. Um, when I think for any other post surgical complication, that is always a natural discussion that happens. Um, I rotated in the urogynecology clinic, helping a lot of elderly women with incontinence and prolapse. And complications from that are always discussed of like, okay, so these are the pros and cons of this surgery, and this is why we still do it. But none of that was discussed there.